Okay. Hi, Miss Williams. I'm Sam. I'll be your student nurse today doing your musculoskeletal assessment.
Okay.
What brings you in today?
My knee's been hurting a lot lately.
Okay. I'm just going to ask you a few questions to assess your strength and your past history and all that.
Okay.
Do you have any trouble walking up or downstairs?
No.
No. Do you have any joint pain?
I don't know if it's my joints or if it's my muscles
Okay.
in my right knee.
Is the pain associated with anything like fever, rash, chills, anything like that?
No.
Do you have any lower back pain?
No.
Any neck pain?
No.
So you're not sure if you have any bone pain. Is it any bone pain, or do you think it?
I would say more of a muscle or joint, not bone.
Okay. Do you have any cramping kind of pain?
No.
Is there any weakness?
Yeah, it's pretty weak. After I run, it's kind of hard to walk on, so it's weak.
Okay. When would you say the pain started?
About a week ago, after I got done running with my mom.
Okay. And you said it's your right knee?
Mm-hmm.
How long would you say it lasts when it starts?
Anywhere from an hour to 2 hours.
Okay. Do you have any other, any characteristic symptoms? Like, is it a throbbing or an aching pain?
It's throbbing.
Is there anything that goes along with it, like a fever or chills or anything? No?
No.
Do you have any relieving factors that you try to do to make it feel better?
Yeah, I put an ice bag on it, and that usually helps out a lot.
Okay. And have you visited any other, doctors or anything to assess this pain?
No, I've taken a leave before it, but that didn't really help.
Okay. Are you on any medications currently?
Insulin for diabetes.
Okay. Any past medications?
No, just insulin.
Do you have any muscle or bone disease?
No.
Any past history of muscle or bone disease?
No.
Does your family have any history of this?
No.
Any family history of diabetes?
No.
Any genetic testing history?
No.
Do you consume alcohol?
Rarely. Once a week.
Okay. Do you do physical activity?
Yeah, I try to run 2 to 3 times a week, but it's been hard to do with my knee and pain.
Right. Okay. I'm gonna just get some vitals from you. Check your blood pressure and your pulse to make sure it's all normal. Let me just stick this on here. Just have your arm on this way. Okay. Put your arm like this. Alright. Just going to take your pulse here. Now we'll start into more physical assessment, assessing your balance, your gait, and all that. So, can you walk in front of me a little bit, like take a few steps, and then turn around and walk back. Okay. Can you put your hands behind your head? And let's see. Can you hold your arms out straight with your palms facing down? And then turn your palms facing up. Okay, and I'm going to test your strength just by pushing down, so try and resist my pushing down. Okay? Let's see. Okay, can you tilt your head to the side, like each side, try and touch your shoulders. And can you bend down and touch your toes? Okay. Just assessing your spine and your arms for any swelling or anything like that. Okay, now I'm going to inspect your knee for any like swelling, any bruising, anything like that. Any bumps or anything like that. And I'm going to palpate, just like touch it to assess and let me know if you have any tenderness, just to make sure your tendons and your ligaments are all where they're supposed to be.
Right in there.
Right there? It's a little tender? Okay.
Just feels sore today.
More sore than usual then?
Yeah.
Okay. Okay, we're going to do a few range of motion tests just to see how well you could move your knee with the rest of your body. So, try and scooting a little bit more towards the edge of the bed, this way. And then see if you can move either leg of yours. Like move your right leg towards your left one, and then try moving it the other way. Just to test for that. And then we'll try it on the other side just to make sure that they're symmetrical with each other. Okay, now I'll have you lay back on the bed and I'll test your extension and flexion of your knee. Okay, so lift your leg up a little bit. Try lifting it so that your knee's bent. Okay, and then lift it straight back out. And let's do the same thing on the other side. Straight. Okay. Now we'll do a few muscle strength tests. So let's try and bend your knee. And try and straighten it as I'm pushing against your calf. Try and straighten it. And then as I'm trying to push down, try and push back against my hands. Okay. Okay. Now I'm going to do a couple of special tests just to make sure your knee is in the right place. So I'm going to push up on your skin to push just to see if there's any fluid sitting there like on your knee or anything. Looks okay. And then I'm going to ask that you flex your quad, like your thigh muscle, and then unflex it, and then flex it again. Okay, it's just checking for a smooth movement with your patella because it moves forward every time you flex, just to make sure that it's moving right. Okay, so I'm going to get all your information, document it in your chart, and then I'm going to go talk to the orthopedic doctor and see if he can come in and further assess you just to relieve some of your knee pain. So I'm going to leave your call light here, and I'll be back in, and if you have any questions or you have knee pain or anything, just press the button and I'll come in and check you out, okay?
Alright, thank you.
Mm-hmm.